Hi, this is Dr. Khanna, and today we are going to talk about retinal detachment and LASIK eye surgery. So retinal detachment, for those who may not be familiar, is when the retina separates out from the choroid, affecting vision. Usually the symptoms are like increased floaters, a curtain coming in front of the eye, and loss of vision. So if you have this problem, usually you undergo a retinal detachment surgery or called retinal detachment surgery. And this may be performed either by just external scleral bands or internal vitrectomy, laser, and some other modifying factors. Now what we have to do is consider that the retinal detachment surgery has been done and person is wearing glasses and they want to lose or get rid of those glasses. So what are our options? So let's look at LASIK first. LASIK requires stabilizing of the eye with a pressure device before a flap can be made. This pressure can affect the vitreous base and affect the retina and cause problems with the retinal reattachment surgery. Even in super LASIK, a similar process is required. So it is best to avoid these two and use PRK or Lasik, which uses chemical to remove the top layer, or a brush which removes the top layer, and so laser can be done. Now, can a previous retinal detachment surgery affect our prescription? And the answer is yes. Especially if scleral bands are used, they induce a lot of astigmatism, and this needs to be corrected. But we have to keep in mind what might be the best time to do this correction. So it's best that the laser eye surgeon discusses this with the retinal doctor, because if the scleral bands are going to be removed, it's better that they be removed first and the eye returns as much towards its normal shape as possible before laser vision correction is attempted. Also, sometimes as in retinal reattachment surgery, the retinal surgeon might inject silicone oil or perfluorohydrocarbon gas. We have to allow adequate amount of time for these to be resorbed or removed. And so between the retinal surgeon and the laser surgeon, the appropriate time can be discussed. But there are a couple other special points to focus on. That sometimes, all our autorefractors and other wavefront machines may not be able to get the correct data because of interferences from the surgical procedures and implants inserted. So it's important that the eye surgeon himself check all the numbers. The intraocular pressure also has to be closely monitored because retinal surgery or the drops following that can increase the pressure. And the LASIK eye surgery or laser vision correction, because of thinning of the cornea, can affect the readings. And finally, the eye drops, which we normally use, which are the steroidal and non-steroidal, they should be tapered slowly, so not to have a rebound haze or affect any other factor in the eye. So if you've had retinal detachment surgery, make sure you discuss these points with your laser vision correction specialist. Thank you.